There probably is a genetic predisposition as well, which obviously, hopefully, Esty will actually look in more into. But the hormonal system and the hormonal system is obviously much more complex in women, and every month, and you'll find clinically, and the clinicians here will know, clinically, premenstrually and menstrual cycles have a major role in the symptoms of ME, and they do. A lot of patients go really downhill premenstrually, and again, it's the breast tissue as well. The breast tissue is where the main drainage of the lymph will actually push backwards, and the women's breast tissue is obviously much more enhanced than men. So we have the sympathetic nervous system overloading, and we've heard this morning how that can happen. The sympathetic nervous system then breaks down, and then eventually you get a reduction of blood flow into the organs, and the lymphatic drainage is affected, as you now know from Kinmont's work, that lymphatic drainage is then pumping the wrong way, which causes further toxins in the body and into the build-up of brain and spine. And it's very interesting that this pathway, this drainage pathway, is both ways. And you heard this morning about the study done in America, Nevada, showing that cancer, brain tumours, and it actually looked at lymphomas, but also they showed that brain tumours were high up, were raised up in some of the ME patients they were looking at as well, or post-Epstein-Barr. So it can run both ways. I'm not saying that you will end up with brain tumours, God forbid, but the worst case scenario of toxicity in a brain can obviously lead to brain tumours. Further damage to the sympathetic nervous system via the hypothalamus, which causes a worsening lymphatic drainage, which causes further toxic build-up, and this vicious circle, I believe we call ME. So these are the signs that physically I feel in every single patient I see with ME, and most of them have been diagnosed by hospitals before they've come to me, via the CDC criteria for CUDA, and you see the varicose lymphatics that we have. We also have a point which was coined by a patient, Perrin's point, so it's stuck. It's lateral to the left nipple, about 1 inch or so, or 2 centimetres, and is slightly superior. And every ME sufferer that I've examined has this tender point. And the reason for, and the more severe the ME, usually the more tenderness. And the reason I've come up with is that we know the thoracic duct goes to the left side and up to the subclavian area. And that we know now has sympathetic nerves. Now the sympathetic nerves lie alongside somatic nerves, sensory nerves, and they're firing off. They cross over. There's crossover of the two nerves, of the nerve axons in areas called epapses. And this is in the books if you want to look it up. And then there's crossover of these sympathetic nerves to the somatics, and it causes a lot of irritation in this area. At the same time, you've got the cardiac plexus, and the heart is very much affected by, and the blood vessels to the heart are very much affected by ME. And that cardiac plexus would cause, again, via crossover to sensory nerves, will cause another large area of sensitivity in this area. Where they cross over seems to be this point here, Perrin's point. There's also, if patients have bowel problems, have irritable bowel or irritable bladder, or lots of aches and pains in their legs, and that's often their case, the celiac plexus, which is the big bundle of sympathetic nerves, also known as the solar plexus, that's very tender. And we see this again and again. It's almost a litmus test to anything below. Any symptoms below this area, fire up this celiac plexus. And we know already, as I've said, that there's spinal problems. And then there's the least known of within orthodox medicine is the cranial rhythm. You might have heard of cranial osteopathy, and it works on this cranial rhythm. And I've written a research paper in the American. It was published in June in the American Journal of the American Osteopathic Association, which goes to 35,000 doctors, because American osteopaths are qualified medical practitioners as well. And they published a paper showing that the cranial rhythmic impulse is actually this drainage. It's a drainage of the hair. It's the reduction of cerebrospinal fluid that is produced by the heart, by the blood. So the heart rate, the 50 to 100 beats per minute, is transmitted through the cerebrospinal fluid. It then drains off to the thoracic duct that Kinmont and Browse worked out was 4 beats per minute. You have 2 waves that create a third wave, and it's this third palpable wave that we're feeling. And with ME sufferers, this wave, this cranial rhythmic impulse, is definitely down. We see this in every single patient. It doesn't mean that the rate changes. It feels, I describe it as feeling like a deflated football rather than an inflated balloon. And we can feel this, it's palpable for people who have trained in this field, can feel it. And these are the physical signs that we see in all ME sufferers.
Raymond, it's